I'm Myron Belfer. I'm a child and adolescent psychiatrist who's worked here at Boston Children's Hospital for many years in the craniofacial clinic. Today I'm speaking simultaneously to those of you who are or have been patients and to parents or guardians. What I will say comes from my experience. I recognize that we all have different experiences in life and in growing up. So much of what I say will be open for discussion. Having a facial difference makes us aware of ourselves in ways that those who do not necessarily think about. The differences can be hardly noticeable or major. A young woman or man without a significant facial difference can be very worried to the point of great psychological distress by a slight blemish and use all sorts of makeup to cover it, or even avoid certain social context. On a personal note, I know that growing up, I was very conscious of having a big nose. People used to tease me about this, and I often thought about having a rhinoplasty, but did not. It contributed to a certain degree of shyness on my own part. I had a choice to have this rhinoplasty, but after much discussion, chose not to do so. I often wonder what difference it would have made in my life. Of course, no sooner did I have to deal with my nose than I had to deal with growing bald, starting at the age of 18. I always looked older than my age, and again, I was the subject of many jokes. It was often the opening line for my friends when they were approaching groups of other individuals trying to guess what my age was. Our focus today is on those of you who are adolescents or the parents of adolescents. This is an age of many changes totally unrelated to any facial difference. At this age, it is perfectly expectable to have mood swings, to feel parents do not understand social situations or personal struggles, and to not know precisely what is in one's own long-term best interest. Also, very importantly, after 12, 14, 16, or 18 years, one grows accustomed to looking a certain way, even if it embodies a difference. And there is a concern about how people will relate if changes are made. I think this is often at the heart of many problems in communicating about completing a cycle of surgery and about decision-making. Will a further change, even if seen by parents or surgeons as being helpful, bring about more comments from peers and somehow change the equilibrium one has with the self or peers? I remember a particular instance where a young man with a very severe craniofacial problem had extraordinarily successful surgery. After the surgery, he went back to his hometown, and in an effort to find out how people thought about him, kept asking people who he was. He wanted to see if people would realize that he was in fact the same person, even though his facial features had changed. For many years of working in the craniofacial clinic, I heard the urging of surgeons and parents for one final operation, or an operation that would make a big difference in appearance, only to hear from the patient that enough was enough, or that all they wanted was a functional change and nothing more to do with appearance changes. I think behind many of these expressed desires for no more surgery was a fear that the change would not work, that raised expectations would not be fulfilled, or that peers would ask more questions. Of course, it is not just the surgery, but the healing process, the bandages, the possible complications. It is here that can be hard to see the longer-term benefits. We all, parents, adolescents, surgeons, sometimes do not know how to respond to frustrations with feelings other than anger. Your son or daughter or patient thinks, "How come you do not understand that this is all I want?" The parent or surgeon thinks this will be good for you. I do not think that it is helpful to pursue a dialogue when the dominant expressed feeling is anger. Rather, it is better to suspend the discussion and, if need be, bring in another person for the discussion. Parents with surgeon or nurse, surgeon with nurse or consultant, adolescent with another adolescent who was previously in a similar situation. For caregivers, being very concrete in their explanations is helpful. They should walk through every step of the process very carefully. Often there are misunderstandings between the family, the patient, and the caregivers about the possible timelines for recovery and other important issues. Interrupting one's life in the adolescent years is traumatic under any circumstances. We see this frequently when moves are contemplated by families. Their caregivers should anticipate social and personal psychological responses in the patient, aside from that related to the surgery. For example, the final surgical procedure may have a very special meaning for him or her. For so many who have undergone multiple surgeries, the hospital is a familiar and supportive place, so it is hard to imagine how one could exist without the special support of the hospital. It is not very different than making the transition from home to school or family to marriage. Now, being a shrink, I'm going to bring up some other related issues that may affect decision making. Sometimes a great many issues are displaced onto the facial difference as the cause of one's problems or potential problems, when in fact the cause of the problem lies elsewhere. This is particularly true when it comes to concerns about socialization, that a particular situation that does not work out is attributed to the fact that one has a facial difference, when in fact it may be related to many other possibilities. The same is true in all types of relationships and in the workplace. We all have particular personalities. It is interesting to note how important our personality is in being successful in relations rather than one's appearance. This is particularly true for long-term, satisfying relations. There is no doubt that being beautiful or handsome would appear to make life easier, but in truth, from the perspective of a psychiatrist, it is remarkable how often those who are pretty feel uncertain about their place and often feel they are loved as objects and not valued as a person. A key to feeling good about oneself is feeling that you have accomplished a task or gained a skill or have a particular aptitude. I think that major efforts to pursue some special accomplishment or to gain an identity as being very good at something helps in all areas of one's life. With the confidence or self-esteem gained from an accomplishment, one can then afford to make decisions and take risks in other areas of one's life. So to be great at chess, to have a great record collection, to complete a marathon, to excel in some school subject, to volunteer with old people, all may help one to feel good. When feeling good, a person has a better future orientation and may look forward to making decisions that will help him or her to be more part of activities and relationships that are possible. Thus, it is easier to make a decision for surgery. Finally, the patient can say that children's and the surgeons have done well by him or her, and they are ready to move on. Thank you.